Sports massage. Sports massage, also called athletic massage, is the application of massage techniques that combine sound anatomical and physiological knowledge, an understanding of strength training and conditioning, and specific massage skills to enhance athletic performance. Sports massage enables athletes to attain their highest potential by accelerating the body's natural restorative processes, enabling the athlete to participate more often in rigorous physical training and conditioning. Massage helps to reduce the chance of injury by identifying and eliminating conditions in the soft tissue that are at potential risk of injury. General benefits of sports massage. Sports massage is not reserved just for the athlete. Almost anyone can benefit from increased blood circulation, stretching, range of motion, and flexibility exercises of sports massage. Some general benefits are: massage causes hyperemia, making more oxygen and nutrients necessary for healthy tissue. Massage stimulates circulation and lymph drainage to flush out the metabolic wastes produced by physical exertion. Massage stretches and broadens muscle, tendons, and ligaments for flexibility. Massage separates fibrosis and breaks down adhesions that result from inflammation and trauma, which restrict muscle movement. Sports massage can reduce recuperation time by as much as 50%. Techniques of sports massage. Many of the techniques of athletic massage are identical with those of classical Swedish massage. However, there are a number of significant differences. Sports massage is performed 2 to 3 times more rapidly than Swedish massage. In addition, sports massage emphasizes passive and active joint movements, stretching, range of motion exercises, jostling, and compression. The following are some of the specialized therapeutic techniques in sports massage that bear special consideration. Compression. Pumping compression utilizes the heel of the palm to repeatedly press the muscle against the bone. The proper way to apply compression is to start the pumping action at the origin of the muscle and proceed to the insertion of the muscle. This technique is identical to CPR compressions. It is 15 to 2, which means you will perform 15 compressions for 4 times with special attention given to the belly of the muscle. Large, broad muscles require several passes to cover the entire muscle. The most important goal of compression is to create hyperemia in the muscle tissue. Deep compressions stretch, broaden, and separate muscle fibers, and in the process release histamine and acetylcholine, acetylcholine. This causes the blood vessels throughout the massaged area to dilate and become more permeable to produce a lasting hyperemia. Jostling and shaking. A good way to relieve the intensity of deep work on the muscle is to vigorously shake or jostle the entire muscle mass or limb. This not only releases the tension that may result from deep manipulation, but also works to loosen fascia and improve lymph movement. Shaking is performed by grasping the body part and vigorously moving it up and down or back and forth so that the relaxed flesh flops around the bone. When shaking a limb, it is important not to hyperextend any joint, especially the elbow or knee. To jostle a muscle, place the massaging hand across the muscle at the origin, and then lightly grasp and vigorously move the muscle laterally across the axis, working from origin to insertion. Reciprocal inhibition. This technique is also referred as proprioceptive neuromuscular facilitation. It is ideal for relaxing and lengthening muscles. This stretching technique has been documented to achieve up to 15% more flexibility than conventional static stretching. It utilizes the reciprocal relationship between the prime mover and antagonist. In this procedure, resistance is placed on the movement of the prime mover. The resistance inhibits and relaxes the antagonist reciprocal muscle. It is accomplished by stretching just into resistance, isometrically contracting the muscle for 5 seconds, relaxing, and repeating the cycle up to 3 times. This is the preferred method of lengthening and stretching soft tissue. Do not stretch or push on joints to the limit of their resistance. This is not only incorrect, but it may injure your client. Applications of sports massage. The 4 basic applications of sports massage as follows. 1. Pre-event massage. Massage prior to an event to prepare the athlete for the exertion of all-out competition. 2. Post-event massage. Massage after an event to normalize the tissues and relax the athlete after competition. This class focuses primarily on post-event massage. 3. Restorative or training massage. Massage during training to allow the athlete to train harder with fewer injuries. It is performed in conjunction with a physical therapist or strength coach. 4. Rehabilitative massage. Massage during rehabilitation to recover from injury more quickly with less chance of re-injure. It is performed under the supervision of a medical doctor. Client attire, forms, and supplies. Clients must be advised to wear shorts or leotards for the massage. If a client comes in without the proper attire, you must modify the treatment plan and/or modify the draping technique to protect their privacy. This massage may be performed with or without oil. However, pre-event massage is always performed without oil. Recreational sports massage. Recreational sports massage is for people who participate in sports as an amateur. They are weekend warriors who work at a regular job during the week and participates in weekend golfing, jogging, basketball, or other recreational sports. Most important, any person involved in an activity or work that requires repetitive movements can benefit from sports massage applications. Step-by-step procedure, 45 minutes. Sports massage is an activity-driven modality. It is always directed by the parts of the body which have been or will be stressed by the particular activity. In this case, we are assuming that the client is participating in an activity that stresses the lower extremities. Therefore, we will begin the massage in the prone position. However, if the activity your client is participating in requires the use of his slasher arms, you will begin the massage in the supine position and focus your attention on the arms. Contraindications. The same contraindications for general relaxation massage apply for sports massage. It is contraindicated in any abnormal condition, fever, injury, illness, heart condition, anemia, diabetes, thyroid disorders, liver, lung conditions, cancer, skin disease, varicose veins, hypertension, internal injuries, wounds, or like conditions. In these cases, massage would be performed only upon the recommendation of the client's physician and at the request of the client. When in doubt, don't. At no time during a massage treatment should a massage therapist render a diagnosis of injury, disease, or a prognosis of care. In Hawaii, only medical doctors may legally do so. Note: Always start any massage with the resting position. Introduce yourself and say something nice to your client. Prone sequence. A1 hamstring compression. 1. Sports compression is performed similar to CPR compressions. 2. Apply 15 compressions on the target area and systematically work from the crease of the buttocks toward the back of the knee 3 times. A2. Kyusatsuho Shinsenho. Rotation and vibration. A3. Forearm rotation and shiatsu. A4. Jostling the hamstring. Work from the origin to the insertion 3 times. View 1. Chucking the calf. Chucking is performed with short longitudinal pushing movements on a target area. The distance of a movement is determined by the elasticity of the skin. Work systematically from the ankle to the knee 3 times. Note: place your knee on the table to support the ankle of your client. Keep this position for sequences B1 to B4. B2. Kyusatsu Ho and Shinsen Ho calf. Rotation and vibration. B3. Transverse kneading with both hands. Calf. B4. Jostling the calf. Work from the back of the knee to the ankle 3 times. C. Rotation of the ankle. Place the leg in an upright position. Rotate the ankle in a clockwise, then a counterclockwise direction. Repeat for 8 times. View 1. Flexing the knee joint, lateral to medial. Slowly push the ankle toward the buttocks. Hold the stretch for 4 seconds. Note: ballistic stretching is contraindicated. Stretching exercises must be performed slowly into slight resistance only. D2. Poi pound. Shake or jostle the calf and repeat the cycle again 3 times. D3. The Madam Butterfly. Slapping fast shaking between the hamstring and upright leg. D4. Stretching the thigh muscles. 1 with one hand, grasp the front of the knee on the medial side and place your other hand on the small of the back. 2. Slowly walk forward to lift the knee. Hold the stretch for 4 seconds. 3 times. Note: 1. Advise your client that all reciprocal inhibition exercises are performed slowly without any abrupt movements and with medium exertion. 2. Advise your client to listen for your go and stop instructions. 3. Advise your client that she or he must sustain the exertion for 4 seconds, and that you will count the seconds in 1/1000ths of a second, e.g., 1,000, 2,000, etc. E1. Leg flexion, reciprocal inhibition. 1. Place the leg in an upright position. With 2 hands, grasp the back of the ankle to resist the flexing movement. 2. Instruct your client to flex his/her leg on your go instruction. 3. Count and hold the leg for 4 seconds, then instruct your client to stop 2 times. E2. Leg extension, reciprocal inhibition. 1. With 2 hands, Grasp the front of the ankle to resist the extension movement. Instruct your client to extend his/her leg on your go instruction. 2. Count and resist the leg for 4 seconds, then instruct your client to stop. Repeat for 3 times. Repeat sequences A1 through E2 on the other side. F. Lateral side of the buttock. 1. Transverse and circular rotations with overlapped hands. 2. Percussion to the top and side of the buttocks. 3. Shin Sun Ho to soothe the muscle. G1. Erector spiny thoracic number 6 to lumbar number 4. Apply Kyo-Satsu Ho and Shin Sun Ho combination from T6 to L4. Repeat 3 times. G2. Transverse and circular rotation the erector spiny L1 to L4. 1. Overlap your hands and apply transverse and circular rotations. 2. Apply Shinsen Ho. H. Apply crosshand stretching of the spine, T1 to L4. I. 2. Thumb rotation, the medial border of the scapular. J. Triceps. 1. Chucking. Work from the origin to the insertion 3 times. 2. Kyo-Satsu Ho and Shinsen Ho. 3. Jostle the tricep. Work from the deltoid to the elbow 3 times. Repeat sequence G1 through J on the other side. K1. Rotation on the occipital ridge. Stand at the head of the table. 1. Place the ball of the fingers of both hands under the occipital ridge. 2. With all fingers, apply circular rotations. K2. Rotation on the back of the neck with the hypothenar sides of both hands. Apply circular rotations. K3. Rotation and Madam Butterfly on top of the shoulders. 1. With the hypothenar sides of the hands, apply rotations on the shoulders. 2. Apply the butterfly to the base of the neck and shoulder. 3. Apply forearm rotation and shiatsu on the top of the shoulders. K4. Kneading the shoulders / suprascapular. Forefinger lifting and thumb heavy technique. K5. Deep tissue massage on the upper back. Thoracic number 1 to thoracic number 5. Apply forearm rotation and compression between the spine and the scapular as needed. K6. Percussion on the upper back. 1. Apply hacking with alternating hands on top of the shoulders. 2. With both hands simultaneously, apply hacking on the upper trapezius. 3. Apply cupping on the scapular. L1. Toes to dorsiflexion and plantar flexion. Kneel at the foot of the table. 1 L1. Flexing the toes, grasp all the toes between your thumb and forefingers. Simultaneously dorsiflex and plantar flex the toes. Repeat 8 times. 2. Rotation and twist. Grasp the toe between your thumb and index finger. Starting with the big toe, rotate, twist, each toe clockwise and counterclockwise 4 times. Repeat 3 times. Then pull each toe 1 time. L2. Roll and shake the foot. 1. Roll with the palm of both hands. Sandwich the lateral and medial sides of the foot and roll the metatarsals between your palms. 2. With both hands, sandwich the heel of the foot. Shake the foot with alternating forward and backward stroking. Optional: windshield wiper movement. L3. Reciprocal inhibition, dorsiflexion. 1. Place 2 hands with the fingers interlaced on the back of the metatarsals. 2. Instruct your client to dorsiflex the foot on your go and stop instructions. 3. Resist the movement of the foot. Count for 4 seconds, then stop. 2 times. L4. Reciprocal inhibition, plantar flexion. 1. Interlace your hands and place them on the ball of the foot. 2. Instruct your client to plantar flex the foot on your go instructions. 3. Resist the movement of the foot. Count for 4 seconds, then stop. 2 times. L5. Leg pull. Stand at the foot of the table. With both hands, grasp the back of the ankle and lift and pull the leg 3 times. L6. Leg shake with traction. With both hands, grasp the back of the ankle. Pull back slightly to provide some traction to the leg. Shake the leg with small up and down movements 3 times. Repeat sequence L1 through L6 on the other side. M1. The anterior of the 1. Chucking on front of the thigh 3 times. 2. Kayasatsuho and Shinsenho. 3. Jostle the front of the thigh 3 times. M2. Transverse kneading of the anterior of the thigh. Place both hands across the center of the thigh. Simultaneously squeeze and roll the muscle. Work down to the knee 4 times. Jostling the thigh. Jostle the thigh. Work from 2/3 up the thigh down to the knee 2 times. N1. The hip joint stretch, lateral to medial. 1. With one hand, grasp the ankle and lift the foot horizontal to the knee and place your other hand behind the knee. 2. With both hands, push the thigh to the 10 a.m., noon, and 2 p.m. positions 2 times. N2. Deep hamstring stretch, optional. 1. With one hand, grasp the foot on the back of the ankle and place the other hand on the front of the knee to lock the knee from flexing. 2. To stretch the hamstring, slowly step forward. To control the leg, you may rest the ankle on your shoulder 2 times. And 3. Figure 8 hip rotation. 1. With one hand, grasp the ankle and lift the foot horizontal to the knee. 2. With your other hand, grasp the front of the knee. 3. Rotate the knee clockwise 4 times and counterclockwise 4 times. Repeat 2 times. And 4. Shaking the knee. 1. Place the knee in an upright position by moving the foot toward the buttocks and place your knee on top of the foot to anchor it. 2. Place your hands on the superior and inferior sides of the knee and shake back and forth for 4 seconds. 2 times. And 5. Quadratus lumborum stretch. 1. Move the foot next to the knee of the opposite leg. 2. Place one hand on the near shoulder and one hand on the side of the knee. 3. Slowly push the lateral side of the knee toward the opposite side. 2 times. And 6. Sartorius stretch. 1. Abduct the knee by placing the foot next to the knee of the opposite leg. 2. Place one hand on the medial side of the knee and your other hand on the opposite hip. 3. Slowly push down on the knee to stretch the sartorius muscle. 2 times. Repeat sequence M1 through N6 on the other side. O1. Deep friction on deltoid with alternation thumbs. Apply deep stroking with alternating thumbs working from the anterior to the posterior side of the deltoid. 2 times. O2. Kaiosatsu ho and Shinsen ho on the deltoid. Rotation vibration. 1. Place 4 fingers on the acromion process with the heel of the palm on the deltoid. 2. Rotate the palm and vibrate. O3. Biceps. 1. Kyosatsu ho and Shinsen ho on the bicep rotation and vibration. 2. Jostle the biceps from the shoulder to the elbow. 2 times. P. Deep friction on the anterior of the forearm. 1. With both hands, hold the lateral and medial sides of the wrist. 2. With alternating thumbs. Apply short, 1 inch, and deep strokes. 3 times. 3. Switch hands and stroke the medial side of the forearm in the same manner. Q1. Reciprocal inhibition for the tricep. Elbow extension. 1. Place the forearm in an upright position. 2. With 2 hands, grasp the front of the wrist to resist the flexing movement. 3. Advise your client to flex her arm on your go instruction. 4. Count and hold the arm for 4 seconds, then advise your client to stop. 2 times. Q2. Reciprocal inhibition for the bicep. Elbow flexion. 1. With 2 hands, grasp the back of the wrist to resist the arm extension. 2. Advise your client to push his or her arm on your go instruction. 3. Count and resist the arm for 4 seconds, then advise your client to stop. 2 times. are 1. Wrist flexion. 1. Interlace your fingers with your client's fingers. 2. Flex the wrist backward and forward 2 times. are 2. Wrist rotation. 1. Interlace your fingers with your client's fingers. 2. Rotate the wrist clockwise, then counterclockwise. 8 times. R3. Finger rotation and twist. 1. With one hand, hold the wrist. Grasp the finger between your thumb and index finger and rotate the finger clockwise and counterclockwise. For times. 2. Twist the fingers clockwise, then counterclockwise. R4. Pulling the fingers. Pull and snap the thumb, then gently pull the other fingers between your thumb and index finger. 1 time. R5. Roll the metacarpals. S1. Arm adduction. Place the arm across the upper chest. Gently push the elbow toward the opposite shoulder. Repeat 2 times. S2. Arm shake. 1. Place the arm on the side of the table with the palms down. 2. With both hands, grasp the lateral and medial side of the arm above the wrist. 3. Gently pull on the arm to provide traction and shake the arm up and down. 2 times. Repeat sequence O, 1 through S, 2 on the other side. T1. Shoulder circles. From the head of the table. 1. Have your client raise his or her arms above the chest and grasp both arms on the ulna and radial bones slightly above the wrist. 2. Circumduct both arms medially and in a forward direction, then circumduct both arms in a backward direction. Repeat 4 times. T2. Shoulder flexion by the client. Advise your client to slowly raise his or her arms overhead. Grasp both arms on the ulna and radial bones slightly above the wrist and gently pull. 2 times. Gently tap your client on the shoulder and tell him or her that the massage is finished.